Local and live. Covering Franklin and Washington counties, it's Let's Talk Tristate. Powered by Home Right Windows and Doors in Waynesboro, the right choice. Voted Best of the Tri-State 2024. Online at homerightwaynesboro.com.
Let's talk Tri-State.
Welcome back to Let's Talk Tri-State, all powered by Home Right Windows and Doors in Waynesboro, the right choice, winner in the 2024 Best of the Tri-State Awards. Today we have a full dais here, which we've never had, so we've only ever had up to two people, so I'm very excited to have this, and I can't think of three better people to have here, all representing WellSpan Chambersburg Hospital. First, we have Dr. Elmer Tang, and he is the interventional cardiologist serving Franklin County. Next up, we have Sue Rosenberry, and Sue is the director of cardiac catheterization lab and cardiovascular services with WellSpan. And finally, we have Dr. Arshad Safi. He is the interventional cardiologist serving Franklin County as well. So both Dr. Safi and Dr. Tang, identical jobs essentially. Is that what we have here? Okay, very good. Just want to get that out of here. All right, so in 2004, the Chambersburg Hospital added a new service which better cared for patients needing heart procedures. And they built and opened the brand new cardiac catheterization lab. Now we're looking at 2024 is closing out. WellSpan Chambersburg Hospital is looking back on the 20-year anniversary of the cath lab, saving lives in Franklin County. Dr. Tang, I'd like to start with you if I could.
Sure.
Now you were the first doctor to get the honor of performing procedures in the cath lab at Chambersburg Hospital. Now, why has this cath lab been a benefit to the patients that it serves?
So it had actually, when it was first conceived, there was a need that was unmet in the community. Mm-hmm. So patients who came in with heart attacks or emergencies had to either get medical treatment or get transferred 40 to 60 minutes away by ambulance at that point. And that was not ideal. You know, an emergency, you need to be treating within an hour, pretty much. Okay. So these patients were not served optimally. So they felt, obviously, that there was a need to offer the service in Chambersburg Hospital at that point. And since then, it's had far-reaching benefits to the hospital. So because we are now able to take care of these patients, they can then have other procedures done in the hospital, because if they run into trouble, we're there to kind of help the patient out if they were ever to have heart issues.
Dr. Safi, I want to ask you this. Most of us know the term cardiac, and many of us probably know the term catheterization. Put those together, and there's that function now exists at WellSpan Hospital. But could you take us through, in just layman's terms, someone has a heart attack like Dr. Tang said. What is it that a cardiac cath lab allows you to do that is so beneficial for patients who may be suffering from a heart attack, for instance?
So the cardiac catheterization lab is just a very specialized room within the hospital where we can provide procedures by accessing to the heart through a blood vessel. So usually when somebody is getting a heart attack, it usually means that they have one or more than one artery which is occluded or closed, and basically that occlusion is causing a damage to the heart muscle. So as Dr. Tang said earlier, having a service within the reach of less than 60 minutes or whatever the time frame you are, it is the best way to stop that heart attack and open up that artery. So for example, if a patient comes to Chambersburg Hospital, his EKG, his symptoms suggest that he's having an active heart attack, our team usually gets activated and our response time is supposed to be under 30 minutes. The time the patient comes to the ER to the time we have to open up the artery, the guidelines by the American College of Cardiology and American Heart Association says the sooner you open it, the better it is, but the target is less than 90 minutes. So when that patient hits the ER, we all get activated, we come to the cath lab, patient is brought up into the cath lab suite, we access the artery either through the artery in the wrist or artery through the groin, go all the way up to the heart. First step is to take the pictures and define what is the problem. And obviously, based on what we diagnose, then the next step is to open that artery with a balloon, put in a stent. And the sooner we do it, the better it is.
Do you have an idea of the percentage more likely a person is to survive said event because of the existence of this lab versus how it was before?
So there are a couple of factors which plays a role. So the sicker is the patient, the faster you can get to them, the higher likelihood of them is to make it through that significant illness. So we know with our heart attacks, not only that you have to survive, you also want to minimize the damage to the heart muscle. So the longer it takes for us to open the artery, the more damage to the heart muscle. And on the contrary, people who comes with even significant massive heart attacks, which we just had an encounter over this weekend, low blood pressure, unable to respond, in those things that every minute kind of becomes very significant. So the door to balloon time is normally supposed to be less than 90 minutes. Mm-hmm. Over the last 20 years in Franklin County and at Chambersburg Hospital, our average has been anywhere between 50 to 60 minutes. Even last year, it was 56 minutes. Mm-hmm. And our goal is try to be even better than, because we know we make a lot of difference in reducing the mortality, which is the death, and also the morbidity, because we want these people to be a part of the healthy society.
Yeah, Sue, it is amazing to think that, just when I think of a heart attack, I think when anyone thinks of a heart attack, it is an emergent situation. There's no other way to put it. But Dr. Safi just saying that the ideal time is the window within 90 minutes. Just me sitting here hearing that, because that speaks to our advancements in medicine, to where a person can even survive in the presence of a hospital for potentially 90 minutes while in an active heart attack is baffling to me. And I think that's amazing that exists. But now Dr. Safi saying that, because imagine just being the patient, the family, who are, our loved one is having a heart attack, and to think that we go from 90, I can't imagine waiting 5 minutes to find out what was going to happen, let alone 90 minutes, and now that's ever being shortened. So it's amazing that exists. But what other services, health services, are provided by way of having the cath lab?
The other services in the cath lab that we offer are EP studies, device implants, ICD, pacemakers. We also do ablations, TE, cardioversions. We expanded the EP services in 2016 to include to be done in the cath lab.
Oh, wonderful. Now, Sue, take us through your function as it pertains to WellSpan. I know I introduced you at the outset, but I want to double back on that if I could.
Yeah, so I started my career in WellSpan in 1989 as a licensed practical nurse, and then became a registered nurse, and worked in critical care, and then transitioned to the cath lab in 2004 as a staff nurse, worked as a clinical manager, nurse manager, and now in the role of director, where I oversee the operations for cath lab and cardiology services, oversee the staff, which is about 40 different staff members for both departments.
Wonderful, wonderful. Sue, let me ask you this. Prior to joining WellSpan, Chambersburg Hospital was part of Summit Health. Now, how long was that affiliation?
We've been WellSpan for about 6 years.
Mm-hmm.
So prior to that, we were Chambersburg Hospital, then Summit, then joined WellSpan.
Gotcha. Dr. Tang, if you could, do you know what the area that you've serviced has been? I know that now, well, let me rephrase the question. Now that the cardiac cath lab has existed, has it broadened the service area, whereas maybe we would have had to go to a hospital outside of our immediate area or well outside?
Yeah, so when the cath lab was opened, it was really groundbreaking in this area. Okay. So there was a time that we used to take patients as far as Hagerstown, Washington County Hospital, used to fly their patients to us before they opened their own cath lab. But these days we service a really wide area, and it includes patients who have heart attacks, for example. In Waynesboro, they get transferred to us. Fulton County Medical Center transfers their patients to us. Gettysburg sometimes transfers their patients to us, depending on the availability of the service there. So we cover a large area, and the population here, since I started, has grown every year. So it seems like we're seeing more and more patients.
Yeah, I mean, just in general, Dr. Safi, as Dr. Tang just said, our population overall is booming. And I think what happens is you have the cities become bigger and bigger and bigger, and they expand farther and farther out. But what has having this cath lab really meant to you? I'm sure you have seen patients do you have patients when you see them that you say, if this didn't exist, our cath lab didn't exist, they wouldn't have made it? There's no way they would have made it.
Oh, for sure.
And what does so take us through, what does it mean to you to have this cath lab versus not? Because you've operated with both, or you've operated with both sides, having it and not having it.
Yeah, no, I think it's a very fulfilling experience as a provider because you're able to make a huge difference, not only somebody's personal life, and it's also from the community point of view. So over my last 20 years here, it's like, you go through this where you even don't know who is who, but then you find out like a week later, oh, that was somebody's mom, and it was somebody's dad, or somebody's brother or sister, because the community is just like very intertwined. We have an example this weekend, very young female, under 40-year-old, comes with a massive heart attack. One of her artery, which goes to the front of the heart, which is like a widowmaker, was 100% closed. She was like in cardiogenic shock. And if she would have been 10, 15 minutes late, or we would not have services here, she would not have survived.
Wow.
So I think that much of an impact. And then when you do the procedure and you talk to the family and you see the little kids and stuff, I think it's just like something which I do not think can reproduce anywhere else. And I think community is very aware of that. And I think in that context, some of the things which we always want to stress, that if you're having a chest pain or your loved one is having a chest pain, please try not drive to the hospital, call 911, because that's another thing which makes huge difference in the outcomes. Because if you're driving and you pass out, there is nobody there to help you. But if you're in an ambulance and people are there, they can certainly resuscitate you, and then our team is ready to take care of you.
And not only that, to your point though, if you would drive yourself, not only are you putting yourself at risk, but you are putting others
Absolutely.
at risk that are on the roads as well. Dr. Tang, let me ask you this, because Dr. Safi hit on this, and I'm going to go right back to this. So preventative measures, what do you say to someone that may want to know, well, what can I do or what should I not do? And I think we hear the obvious things, well, less saturated fats, things like that.
Right.
Is it really as basic as that?
So it's funny because every patient who comes in did not think that they were going to have a heart attack.
Mm-hmm.
It's something that nobody really thinks that's going to happen to them. So if if I could have spoken to them a year or two before, I would have told them that if you're in a certain age group, if you have a family member who's had heart disease, who's needed a stent, needed a bypass, had a heart attack, you probably need to be checked because genetics play a big role. Mm-hmm. Everyone always says that you have to be healthy, you have to watch your diet, exercise, quit smoking. And yes, we always say that. But really, risk is a little bit more than that. It's also controlling your blood pressure. It's also making sure that if you have diabetes, it's under control. If your cholesterol is elevated, that needs to be controlled. And again, if you have a family history, you are at higher risk. So those are the patients that we generally pay attention to a little bit more.
You can't outrun the genetics, as
Yes.
I've heard before, but
Can't
you
choose your
certainly,
parents.
yeah, exactly. You can't choose that, but you can choose your habits.
Yes.
Right. So, Dr. Safi, I want to end with this because we've been talking about the heart and cath lab that is available to everyone at WellSpan Health that may need it. But obviously, it's one of those things, and I always say we just got off of parade season, is what we call it around here. So we have a lot of our EMS and fire and rescue goes by, and police. And I always say when I'm making the announcements, these are the folks that we hope we never need to use them, but we're glad they're here when we need them. Same thing with the cath lab. Hope you never have to use it, but it's wonderful that it is here. But basic here, Dr. Safi, what are the signs of someone having a heart attack?
So the common signs which people look for is, number, you can have a very significant chest pain, which is right in the middle of your chest. You feel like pressure. It might radiate to your both arms or not. You might have a tingling of your fingers, maybe more on the left upper extremity. You might develop shortness of breath. In some rare cases, people pass out. There is like almost 20% of the heart attacks where you are no symptoms. These are silent heart attacks. And they tend to happen more in diabetic people because of the nerve endings damage in that population. So I think those are the things which sometimes in females, it could be a very atypical presentation. You don't get chest pain. You might have fatigue and tired and not feeling well. So I think some of the challenges which we feel and we always try to educate community is, number one, do not ignore your symptoms, especially in male population.
Right.
They're very reluctant that I don't want to see the doctor, I don't want to go, and ultimately they sit home for a day or two and then the symptoms don't go away, and by the time they come, then they are in a worse shape and they could have a much better outcome if they would have just come right away. Mm-hmm. And same thing, I think, in women population, they always try to underscore their symptoms because they're busy with the family lives, the children, the parents, the husbands. And our education on their end is like, take care of yourself.
Yes.
If you're healthy and taken care of, you're going to be able to help your family in a much better shape than if you're not doing well and not healthy.
That's absolutely right. You're speaking my language with that, doctor. I subscribe to that when it comes to emotions, when it comes to your stress and anxiety, not taking care of yourself first, all of which can affect this. So health-wise, we got the final word from Dr. Safi and Dr. Tang. Thank you for being here as well. But Sue, I want to talk to you just real quick at the last minute that we have here. What's the future with the cardiac and cath lab with WellSpan Health? Are there more things coming down the pike with that, or is there something else added to that supplements that as well and will be something nice ancillary to go on with that?
We are looking at some additions to the procedural rooms or updates to procedural rooms, and then looking at maybe some other potential services that we could offer as far as some renal care and things to patients.
Well, this has been wonderful. I again hope that I never have need of it, but I'm so glad that it exists. If not for me, for my family, and for our community, and all across the tri-state area. So, Dr. Tang, Sue, Dr. Safi, thank you so much for joining us today on Let's Talk Tri-State.
Thanks for having us.
Let's talk Tri-State.
If you'd like to be featured on an upcoming episode of Let's Talk Tri-State, call 717-597-9200 or email letstalk@921thegoat.com.